Hi. So I guess this is the introduction video. I just tried to do this already, and I have been on YouTube for so long that I forgot that there's a time limit on the first videos that you put up because you don't have any subscribers. So I'm redoing this video. My name is Betsy. I have started a new YouTube channel to talk about my journey with myelofibrosis, which is a rare bone marrow cancer that's chronic, um, and it creates scar tissue or fibrosis, fibers, right? Scar tissue in your bone marrow, and it literally like suffocates your bone marrow and like sucks the goodness out of it. Um, and I'll talk about, um, how I was diagnosed and how it was found probably in another video because this is really short. So I just wanted to introduce myself in this one. I'm 44 years old. Typically, those who are diagnosed with myelofibrosis are about 20 years older than I am. There are only 20,000 people in the entire world, estimated approximately 20,000 people in the entire world that have been diagnosed with this. So I'm a unicorn. I'm, out of how many, I don't know, 20 billion people. There's a lot of people in this world. And I'm like, I'm like less than 1%, like way less than 1% of that. So it's safe to say that in the last 3 years since my diagnosis, there hasn't really been a lot done for treatment. Right now, they're kind of treating it like it's a chronic leukemia, where I go see my oncologist every 3 months. I take a chemo medication every day, and I take an immuno-targeted therapy every day. I'm still in the early stages. And I am not really the kind of person that just sits around and like waits for things to happen. So when they tell me that I just have to like wait and see, I'm not okay with that. I'm just not okay with that. I moved from Kansas City, where my three boys are, my partner and I, Henry, who's a wonderful caretaker partner and my best friend. Um, it's amazing to have a lover that just wants to take care of you at the same time too. Um, I moved from Kansas City to Colorado to get better treatment, and I haven't had an oncologist. I've had two oncologists in the last 3 years, and not one of them has um, told me about this disease. I found out on my own about it. I researched it. I joined Facebook groups, and there's very little out there about it. So I've learned a lot in the last 3 years on my own. And because I'm just that kind of person, I had mentioned that, in the beginning of this video, that I already have a YouTube channel. I have been a professional astrologer and tarot reader for the last 7 years on YouTube. My channel is Fearless Intuition, which is also my main source of income. If anybody wants to go over there and check it out, the algorithm has kind of pulled me out of that, with that channel. So I've been kind of fighting an uphill battle to get back into the algorithm after having to take time off because I got sick. So it's been a really weird and interesting 3 years. Like it's just been really strange. And um, I want to use this channel to bring awareness to a lot of things. Like I wish that I could just spill it all out in this video, but again, I remembered that it can only be under 10 minutes. Like, um, but I want to bring awareness to a lot of stuff. I want to bring awareness to what's happening in the medical community, because the story, it's not just my story. What's happening in the medical community to patients right now is not just my story. It's ridiculous. Humanity has has changed so much that there is a lack of patient care. Um, Nobody slows down enough to make sure that everything is good first before proceeding. And that is really frustrating. And I'm not the only person that says this. I'm not the only person that has said this at all. I've seen many stories where there's just failure. There's just failure in the healthcare community in big ways. So with this channel, I want to bring attention to that, and I want to bring attention to the advances that are happening. I know there are advances that are happening with this disease already. We're planning on moving to New York after I researched and found some clinical trials that and sent all of my information out to Sloan Kettering in New York. So hopefully this is going to be my third attempt, you guys. Like, welcome to my journey. I hope you want to join me and kind of watch the shit show that I've I've been doing for the last 3 years. It's been wild. Like I think that some people don't really believe me at how crazy and wild this journey has been. So I appreciate everybody who wants to show up here and hang out with me. I I don't know. Life is full of twists and turns, isn't it? And I think that we all just kind of need people right now. And I want to be part of the change. I don't want to just sit around and wait for things to happen. I want to be a part of the change, and I've had a voice on this platform for a while, so I just here we are, just doing it more. So thanks for hanging out with me and listening to me for the time frame that we have here. I will be back regularly talking about. I really want to talk about my symptoms because I have actually noticed an uptick in people in my demographic, my age, and with women that are getting this disease. I'm noticing that in the Facebook groups that I'm in. So, yeah, I'm going to put my symptoms out there in a different video so everybody knows what to look for and things that you absolutely do not want to ignore. Symptoms you never want to ignore on your body. So, thanks for hanging out, guys. I'll be back soon.